Welcome to Boulder County Public Health's training on the Boulder County COVID-19 Vaccine Distribution Dashboard. This tool aims to give Boulder County residents more information on COVID-19 vaccination rates in the county. In this training, you will learn about the major parts of the dashboard, including the left-hand pane, which features a summary of Boulder County status, and the right-hand pane, which features several views that allow the viewer to dig deeper into details. We'll also go over some of the ways you can sort and interpret data. This is the main homepage of the vaccine dashboard. This is what you'll see when you first open the dashboard. Here, you can see the two main parts mentioned before, a general overview of Boulder County on the left, and a window with views that change when you interact with them on the right. We'll start on the left. First, we'll walk through the items that show up on the left. These don't change as you navigate through the dashboard on the right-hand side. All the percentages and numbers you see here reflect the population of Boulder County residents who are currently eligible to receive the COVID-19 vaccine. At the top, we see the percentage of the eligible Boulder County population with at least one dose of the COVID-19 vaccine. This is one of the main metrics being tracked at both the state and regional levels to measure vaccination progress. Below that, we see these data broken out into 1, those who have received a partial series, meaning the first dose of a 2-dose series like Moderna or Pfizer, and 2, those who have received a full series, meaning 2 doses of a 2-dose series or 1 dose of a 1-dose series like J&J. You can see both the percentages and numbers associated with that percentage in this panel. You can also see that these numbers are out of a total of 290,000 people and not the entire population. This number reflects the current population who are eligible for the vaccine across Boulder County and will change when age ranges or other requirements change. On the lower left, you'll see a small map. This map doesn't have any data about vaccination status, but its function is to show the geography of Boulder County to help people who may not be as familiar with its cities, towns, and municipalities. You can zoom in on different areas here. Next to the map, you'll see the Definitions tab. This tab gives more context on some of the terms used throughout the dashboard to help guide you as you dive deeper into the dashboard. If you prefer to read something on the bigger screen, you can click this icon in the upper right-hand corner of the module. Click to enlarge that specific module, and click again to shrink it back down to its original size on your screen. Now it's time to dive into the different components of the dashboard. To start off, we have a map here. When we click on this icon, we access several themes or layers. Let's look at vaccination rates by census block group theme. You can zoom into this map if you are interested in a specific census block group and click on it. If the tooltip doesn't pop up for you, you might have your window a little too small. Click on the arrow to expand the informational window. You'll see a window with info for that census block group. Here there are 1, number of people in the eligible population who are vaccinated with at least 1 dose, 2, total number of people in the eligible population, and 3, percentage of the eligible population with at least 1 dose. Side note, if you zoom too far and have trouble realigning the map, you can click on this home icon to reset the view. You can also see on the right-hand side, there is a legend. The legend explains what the different colors represent in each layer. These layers are a powerful tool for interpreting vaccination data. As an example, let's say you're interested in not just looking at vaccination, but also looking at case rates. I have the vaccination rates by census block group layer active. I'm going to click the checkbox beside this layer to deactivate it, and then I'm going to click on the checkbox beside COVID-19 cases by block group to activate that layer instead. The map is now showing a different color. Let's click back on Legend to find out what each color means. You'll see that, in this view, the darkest blue represents the highest number of cases in a census block group over the course of the COVID-19 pandemic. We can use this map to look more closely at a census block group and begin to interpret the relation between case rates and vaccination rates in specific areas. We can see that currently this block group's total count of COVID-19 cases is 98, which is in the highest percentile grouping of cases across the county. You can view the legend for several layers at a time by clicking the small arrow to the left of the layer. This will make the legend for that specific layer appear underneath. If we look back at vaccination rates for the same census block group, we notice that even though they are among the highest number of cases, they actually have a relatively low rate of vaccination. Only 60% of the eligible population there has been vaccinated. This info may indicate to us that there is a need for increased vaccination efforts in the census block group, whether that is running educational campaigns or offering additional access to clinics. There are several layers available, including vaccine providers and socioeconomic theme, just to name a couple. You'll also see a layer that shows CDC social vulnerability information. You can learn more about the Social Vulnerability Index by clicking on the Info tab here. To change views, click these arrows at the bottom of the dashboard. Depending on the size of your screen, you might only see tabs without arrows, in which case you can click to view a list of available views and select the one you're looking for. Next, we see a dial showing vaccination progress for each age group. Here, you can see that the lightest green indicates a lower percentage of that age group has received at least a partial course of vaccine. A darker green indicates a higher percentage. Several views include these dials with slightly different breakdowns of data. In the next view, we see dials that show the percentage of partial course vaccinations by race and ethnicity out of the entire eligible population. You can see in this particular breakdown that the rates are relatively comparable. For this reason, you won't see a big difference in the greens on the dials. The next few views will continue to show gauges and percentages of vaccination rates, but will change age brackets. Age-specific race ethnicity breakdowns can be used to see how disparities might differ across age groups so that we can address needs in certain populations. For example, because the vaccines were made available first to the most vulnerable age groups, we expect to see high rates of vaccination in the 70-plus age group. However, we can see here that American Indian and Asian Native Hawaiian populations' vaccination rates actually decrease when we move from 50 to 59 all the way up to 70-plus. Our next view is the vaccination coverage by age breakdown. Previously, we saw a gauge showing a percentage of the population, but you might want to know how many people that percentage actually represents. Here, we can see the partial course and full course numbers for each age group. You can hover over each bar to see how many people are represented there. You can also choose to toggle on and off these options on the right-hand side. Using the drop-down in the top right corner, you can filter this data by city. So I will filter to show data only from the city of Boulder, and the bars will change to reflect my choice. Please note that while the Data by City drop-down box in the top right corner is always visible, it is only available in certain views. You'll see the note, "Can filter by patient city" at the bottom left corner. When using this drop-down will change your view. Let's switch this back to all cities. The next view shows vaccination coverage by race and ethnicity. Again, we saw this information earlier as gauges, but you can now see the numbers that make up those race and ethnicity percentages. You can see again that you can toggle between courses, and view city-specific data here as well. Our next view includes data on vaccination coverage by gender. There are two limitations to note with this view. 1. Currently, our data system has a binary representation of gender. Because of this, we only have the options of female, male, or unknown, which you can see represented on the bottom. We know that this does not represent the gender identity of each individual. When these data become available, we will work to incorporate additional gender identities here. 2. The second note is that an individual's gender identity might not align with how it is represented here. They may be represented in this data as female, but identify as male or non-binary, for instance. Please keep these in mind when interpreting data in this view. This view is just like the previous graphs we saw in that we can toggle between full and partial courses, sort by city, and hover over bars for more info. This tab shows the vaccination coverage by date. This view is a little different from previous views. You can still filter by city using the dropdown. However, here we can look at full course at the top or partial course at the bottom. Use the slide bar to zoom in on a specific date or dates. And hover over the bars to see the actual numbers on that day for full or partial course. Lastly, we have embedded the Denver Public Health dashboard, which includes regional vaccination information. This dashboard has information on vaccine doses administered by county, as well as the percentage of coverage of the eligible population by county over the metro region. You'll see Boulder County in red. You'll also see a map similar to ours, although at a higher geographic level. One thing to note as you're interpreting data is that the Boulder County vaccination dashboard shows data by census block group, whereas the DPH dashboard shows the census tract. A census tract is a compilation of block groups. It's not quite as granular, but these data are still useful because we can compare rates across the entire metro area. Pop up the legend on this map to view comparisons. The areas with the lightest color have the lowest vaccination rates. You can see in Boulder County that there are some census tracts in gray, which represent lower rates of vaccination. People who are vaccinated outside of Colorado would not be represented in this data set. However, if a BOCO resident who has a permanent BOCO address was vaccinated in another county in Colorado, it will be counted here.